So first off, the Hippocratic Oath, first do no harm. Obamacare was a fantastic improvement. We shouldn't have to defend it, but we do. But there's over 20 million Americans today that have health insurance that didn't before, and best estimates is that's about 20,000 to 40,000 Americans every year who aren't dying that used to. So when Roscom and others attack that plan, that's what's at stake. Defend that. The second piece, and I love your question about the transition because it is the million-dollar question here. There are no trade-offs here if you look around the world, because if you look at the rest of the OECD countries and say, I only want to look at those countries that deliver better overall health outcomes and lower costs, you rule out a lot of them. The ones you're left with all have universal health care. So there is a moral issue, but there's just a don't be an idiot issue here. If you want cheaper, better health care, you go to universal health care. The systems that are, in my view, the best to emulate are actually interestingly the ones that are easiest to get to. The Swiss and German system, Switzerland pays about 2/3 of what we do and has about half the unexpected fatality rate from their healthcare system, which means roughly $1 trillion of savings. And their model, interestingly enough, looks like the Obamacare market with a full public option, with a full suite of Obamacare exchanges and essentially a means-tested floor that makes sure that everybody gets the floor and then you can opt up into other systems. And that model delivers really good outcomes. One last thing, just as an oh, by the way, better than every OECD country in terms of health outcomes is the state of Minnesota. So we can learn a lot internally just about what the differences are between US states as well.